Good morning again, guys, and I'm here again, your teacher, Miss F, to give you another important topics as certified nursing assistant. So we will be discussing the death and dying. Okay, most of us we are very afraid about death and dying. That's why we don't want to go to hospital because most of us, our perception uh, for hospitals is it is a deathbed for the people. But as the time goes on, okay, because of my experience, I saw a lot of patients died because that is their, I think it's their time to die. And I learned a lot on how to take care of them, okay, during their death and dying times. And today I'll be discussing to you what are the techniques and the important points, guidelines in taking care of patients who is about to die and already dead. So let's start. So at first, we should be familiarized with different terms. So first, what is grief? Grief, it is defined as mental anguish, specifically associated with the loss. Okay, we are feeling the grief if we lost someone. We are feeling the grief if someone leaves us. So what if your one of your family member died? How you will accept that? How you will tolerate that? How you will manage and deal this kind of situation? So, as nursing assistant, we are bound to support our patient, not only physically, but also physically for the patient and also the relative or the significant others emotionally. We should use the empathy, okay? Empathy technique, okay, on dealing with this kind of situation. It's very difficult if you saw someone is crying, if you saw someone is grieving, it's very difficult, but we need to be strong, okay, so we can do or perform our job well. So before we'll go to the death, okay, we'll just discuss what are the signs before patient will die. First sign is restlessness and agitation. Actually, before the New Year's, before January 1, we had one patient who died in her hands. Okay. Actually, this patient, it's a alcoholic patient. Acute pancreatitis is the case. And at the blink of an eye, the patient arrested, and uh we did not uh what they call this, we cannot revive the patient. So these are the signs that we saw to the patients. Okay, first is restlessness and agitation. The patient is about to kick us and punch us, okay, that time before he died. So what's the reason? Because the patient is not having an enough oxygen. That's why he's restless and agitated. Shortness of breath, pausing in breathing, depression, anxiety, drowsiness, confusion, constipation or incontinence, nausea and vomiting. Okay, healing problems, swelling. Okay, you will notice that the hands and the legs and the other parts of the body is swollen. Another signs are movement, muscle tone, and sensation are lost. Okay, even if you pinch the patient, he will not uh, respond. Then peristalsis and other gastrointestinal functions slow down. Abdominal distension is notable. Fecal incontinence. So you will see the patient will pee a lot. The patient will poo a lot, and he will have vomiting. Okay, all the secretions will go out. Okay, if the patient has signs of dying. And body temperature rises also, circulation fails, respiratory systems fails. And it will include breathing sounds or noisy and gurgling, usually called the death rattle. Pain decreases as the person loses consciousness. The signs of death include no pulse, no respirations, and no blood pressure. Okay, so that's why you will revive the patient. You will do CPR for the patient because there's no pulse, no uh, respirations, and the patient is unconscious. So these are the signs the patient will die. Let's go to first, let's go with Kubler-Ross grief cycle. Okay, as a nursing assistant, okay, as I've told you, will encounter patients or relatives who are grieving. And these are the usual cycle that they are undergoing. This is called the DABDA, DABDA. Okay, at first, they will feel denial. Okay, they will avoid the situation, they are confused, okay, they're feeling elated, they are shocked, and they are fearful. After that, they'll be angry because they are in that stage of anger. They will be frustrated, irritated, and anxious. After that, they will bargain. Okay, they will ask, "Why this happened to me? Why my son? Why my daughter? Why am not I?" Struggle to find meaning, reaching out to others, telling one story. Then depression. After that is depression. Okay, the stage of depression is overwhelmed. You're feeling helpless, hostile, and flight. Then after you encounter these four stages, okay, you will be accepting the situation. After accepting the situation, you'll be okay. Okay, if over the 6 months you're still in the depression stage, they can diagnose you as having major depressive disorder. Okay, so during denial and anger, you have your responsibility is information and communication. You communicate them therapeutically and give that uh, exact information that they need. During bargaining, you can do emotional support. And during depression and acceptance, you can direct them, you can guide them on what they will do emotionally, physically, whatsoever. Next, caring for a dying person. Okay, dying people have psychological, social, and spiritual needs. You need to listen and use touch, okay, but not all patients accepted this kind of technique like touching because some nationalities, some culture, they don't accept this. Okay, if the patient is dying and he has problem with vision, hearing, and speech, okay, usually most of them have vision blurs and gradually fails. Explain what you're going to do the person on the room, provide good eye care. Then hearing is one of the last function which will be lost. Okay, always assume that the person can hear, so don't tell anything that can hurt the person because the last function that will be lost is the sense of hearing. Then speech becomes difficult. Anticipate the person's needs. Do not ask questions that need long answers because they will be having difficulty breathing. Mouth, nose, and skin. Frequent oral care is given as death nears because most of them is vomiting, nauseous, okay, nauseated. So you need to give frequent oral care. Crusting and irritation of the nostrils can occur. Carefully clean the nose, especially if they have oxygen. Skincare, bathing, and preventing pressure ulcers are necessary. Change the linens and gowns whenever needed. Elimination. Urinary and fecal incontinence may occur. Most of them, they will pee, they will poo a lot. Okay, so you always give perineal care. Comfort and positioning, skin care, personal hygiene, back massage, oral hygiene, and good body alignment promotes comfort. Frequent positioning, changes, and supportive devices promote comfort. Semi-Fowler's position is usually best for breathing problems. You should always make the room pleasant for the patient because this is their last day. This is their last time on the earth. So make sure that their rooms are pleasant and comfortable. Mem- memo- Mementos, pictures, cards, flowers, and religious items provide comfort. So the person and family arrange the room as they wish. What is hospice care? Anyway, you will encounter hospice care. These are designed to give supportive care to the people in the final phase of life. It means there's nothing, no cure, no treatment at all. So hospice care is given. So to assist in their terminal illness and focus on their comfort and quality of life rather than cure, especially like terminal cancer. They are doing only hospice care to make the patient comfortable, to prevent decreased pain, to relieve the pain, and to improve the quality of life, the time remaining for this person in this earth. The goal is to enable patients to be comfortable and free of pain so that they live each day as fully as possible. Caring for family, you're not only taking care of the patient because you need to emotionally care for the patient's significant others. Okay, be available, be courteous, be considerate. Okay, if they are shouting on you, please understand them because they are undergoing some difficulties. The person and family need time together. However, you cannot neglect care because the family is present. Most agencies let family members help give care. So, if you're there in the patient died already, we have three stages of death. We have the algor, livor mortis, and rigor mortis. Okay, you can remember them on the first letter of their alphabet. Algor, livor, and rigor. So algor is the first stage, livor is the second stage, and rigor, R, is the last stage. Okay, so what do you mean by algor? What will happen to the body is it will be cold. It will be cold. Okay, so this is called, this is the cooling of the body. While livor mortis, it is the discoloration of the body after death due to the gravitational settling. If you will notice, if the patient is lying supine, okay, you will notice that there will be discoloration on the back of the patient because all the uh, blood is going down by gravity. Then lastly, rigor mortis, it is the stiffening of the body. You should clean the patient, do the postmortem care within 2 to 4 hours because the patient will be hard after that. And you need to shift it on the morgue, okay, within that time. So what are the things you need to do for postmortem care? First, we need to remove all the equipment and soiled linens, okay? Even the patient died, we need to provide the patient a bed, clean bed sheets. Okay, we need to remove all the equipments attached to the patient. We need to replace also dentures. Okay, remove the lines, tubes, and dressings as per policy. If you're allowed, you can remove the IV, you can remove the tube or whatsoever. It depends the policy upon the policy of the hospital if you're allowed. Then close the eyes. Okay, it's very scary if the eyes is open when the patient died. And when the patients undergo rigor mortis, wherein the body stiffens, okay, you cannot do anything. So please close the eyes and please close the mouth. There are some institutions they are using something, a strap to close the mouth, okay, to prevent it from opening during rigor mortis. Then place a pillow under the head. Fold a towel under the chin to close the mouth. These are some technique to close the mouth. Then you need to give bed bath for the patient. Okay, not only like what's it, live patient you'll give bath, but also dead patient. Okay, then place a pad under perineum. Okay, because the patient will poo a lot and will pee a lot. Okay, and we can put also cotton here on the nostrils and ears because all secretions will comes out. And change the linens and gowns, straighten the body limbs. So these are the post-mortem care we will do during that death of the patient. So how we will cover the patient, okay? We are using a linen, okay? So first, okay, we will tuck or we will close the, what's this? We will close the head and then the legs and then the sides. Okay, before that, you need to put a tag on the patient's feet, okay, for the identity of the patient before shifting to the morgue. So, assisting with postmortem care, practice hand hygiene, collect the supplies needed, provide privacy, raise the bed for body mechanics, make sure the bed is flat, put on gloves. Position the body supine. Okay, make the limbs straight. Okay, head elevated. You can put pillow. Close the eyes. Okay, apply moist cotton balls over the eyelids if the eyes will not stay closed. Insert dentures if the agency allows or policy allows. If not, put them in a labeled denture and give it to the significant others. Then close the mouth. Okay, follow agency policy for jewelry. Okay, most of them they have jewelry. You need to hand over the jewelry to the relative. Some except of the wedding rings, it is kept on the ring of the patient. Place a cotton ball over the rings, tape them in place, and remove drainage containers. Remove tubes and catheters. Use the gauze and squares as needed. Bat soiled areas with plain water. You should bat the patient totally. Place a bed protector under the buttocks. Replace soiled linens or dressings. Replace them with clean ones. Put a clean gown on the body and position the body. Brush and comb the hair if necessary. You need to provide or to uh, what's this to promote the dignity of the patient. Okay, this is the last day of the patient. You should keep all your best to care for the patient so he will not hunt you. Cover the body to the shoulders with the feet if the family will allows. Okay, some institutions they are not allowing you to cover it. Okay, because the relative might come. Okay, but if there's no relative to come, you can cover it. Gather the person's belong is very important because most of the relatives they are claiming like this, etc., etc. I have jewelry, for, I have ring. So you need to put it on a labeled container and give it to them. Remove supplies, equipments, and linen straight to the room. Provide soft lighting. Remove and discard the gloves. Let the family view the body. Provide them privacy and return to the room after they leave. Practice hand hygiene. Put on gloves. Fill out the ID tags. Usually it is put on the big toe. Okay, then in the big toe you'll put it again on the outside of the packed body, and you need to put again one more on the body bag itself where you will put the body. So this ends our topic in post-operative care. I hope everyone understands it, and I hope you keep in mind that not all patients will survive, okay, all their diseases. Most of them, not all of them survive. So what we do, what we will is our responsibility. What's our responsibility as nursing assistant? We can help them. We can do our best to give the best care as possible on their last time on earth. Thank you, and I hope you understand that this topic. If you have any questions, again, you can raise your topic or you can raise your questions in our WhatsApp group. Okay, so sorry for my voice because I think I use all my voice the whole because I just came from work. And thank you very much. And this ends my topic. Thank you.